The old analog ways, freehand, those stackable guides, those type of things, that's what we used before. Now with Yomi, it's extremely streamlined. It's so much more exact, it's more predictable.
Basically, I always explain it to patients like Yomi absolutely removes all of the human error from things. We can be incredibly accurate. We're not worried about, oh, I can't keep my hand at that specific angle, I can't hit it at this certain millimeter. With the Yomi, it's not an issue whatsoever. It just basically took what we were already doing and elevated it to a level that makes patients more confident.
Before surgery begins, a link is established between the patient and Yomi using a two-stage fixation platform called YomiLink, which tracks the patient's anatomy at all times. This in turn allows Yomi to adjust to any movement and provide accurate guidance to the provider throughout the surgery.
The robotic guidance, the haptic feedback, really gives us a sense of confidence. We can get into some tight areas and feel confident that things are going to go well and the implant ends up exactly where we want it. Especially full arch cases with Yomi guidance, our full arch time in surgery has drastically reduced.
For Mary's case, Dr. Haydt and his team will place 8 implants in the maxilla. This full arch case is planned within the Yomi Plan software, and the Yomi robot will use this treatment plan to guide the surgery.
We do these robotic workflows, we plan our own surgeries. Same knowledge, same everything we had before, we just make it that exact.
The guide arm actively assists the provider, guiding the handpiece to the trajectory of the treatment plan. With haptic physical feedback, audio, and visual cues, Yomi ensures precise implant placement and procedural efficiency. While in guided mode, Yomi physically prevents off-plan movement and stops the drill at the planned depth to ensure accuracy and safety. While Yomi guides his movement, he is still in complete control of the surgery.
So what it did is that these cases that were difficult, that you really couldn't do, now you can. Say when you're freehanding, you're worried about a couple different things. You're worried about the saliva on your mirror, you're worried about the way your neck is turned, you're worried about the tilt of the drill. You're not worried about any of that with robots. You can take all of that out of the equation, you just push.
Because we are able to be more conservative with our surgeries that we do with Yomi, so that automatically cuts down on post-op pain after dental procedures immensely. And it's almost to a point now that patients are surprised how good they feel the next day after having a surgery done, because it's night and day.
After drilling the osteotomies, we enter the restoration phase. Yomi integrates with all types of digital workflows. Various techniques can be used to pick up the final implant position, allowing a custom restoration to be precisely fit.
Yomi has changed the game for us by eliminating human error, making things so much more simple for assistants, doctors, the patients. The accuracy is tremendous. I actually can tell that the smiles are better because Yomi has been involved.
The precision and ease of use that comes from Yomi is why customers have performed over 50,000 osteotomies robotically.
Yomi on every level has been a game changer for us.
From my perspective, after surgery with Yomi, the biggest benefit is to our interactions with our patients. They have a good experience. We have been more conservative and less invasive in the surgery itself. They heal better, they're happier, things have gone really well. For me, addressing new cases after Yomi surgeries, then I gain confidence and I feel like I can help more people.